Hello everyone, my name is Sumit Suresh Achalia. Our today's topic is anti-hypertension. So hypertension is another name of high blood pressure. It can lead to several health complications and increase the risk of heart disease, stroke and sometimes death. Blood pressure is the force that a person blood exerts against the walls of their blood vessels. These pressures depend on the resistance of the blood vessel and how hard the heart has to work. Almost half of all adults in the United States have high blood pressure, but many may not know they have it. Hypertension is the primary risk factor for the cardiovascular disease, including strokes, heart attack, heart failure, and aneurysms. The managing blood pressures is vital for preserving health and reducing the risk of these dangerous conditions. The read on the learn why blood pressure can increase, how to monitor it, and a way to keep it within the typical range. The lifestyle adjustment are the standard first lines treatment for hypertension. Some recommendations are as the regular physical exercise. The current guidelines recommended that all people, including those with hypertension, engage in at least 150 minutes of moderate intensity aerobic exercise every week, or 75 minutes per week of high intensity exercise alongside 150 minutes of exercise. Most adults will benefit for engineering the strength of training at least 2 weeks per week. People should exercise at least 5 days every week. Example of suitable activities are walking, jogging, cycling, and swimming. The stress reduction, avoiding or learning to manage stress can help a person control blood pressures. A few relaxation techniques that can help reduce stress are meditation, warm bath, yoga, going on long walks. People should avoid consuming alcohol and essential drugs to cope with stress, as this can contribute to elevated blood pressure and the complications of the hypertension. Smoking can also increase blood pressure. Avoiding or quitting smoking reduces the risk of hypertension, seriously heart condition, and other health issue. Medication. People can use specific medication that treat hypertension. Doctor will obtain recommended a low dose at first. Antihypertensive medications will usually only have minor side effect. Eventually, people who hypertension may need to combine two or more drugs to manage their blood pressure. Medication of hypertension include diuretics, including thiazides, chlorothiazidine, and indapamide, beta blockers and alpha blockers, calcium channel blockers, central agonist, peripheral adrenergic inhibitors, vasodilators, angiotensin converting enzyme inhibitors, agonism receptor blockers. The choice of medication depends on the individual and any underlying medication conditions they may experience. Anyone taking antihypertension medication should carefully read to label of every over the counter OTC drug they may also take, such as decongestants. The OTC drug may intake with the medication they are taking to lower blood pressure. So diet. People can prevent high blood pressure by following the heart healthy diet, reducing salt intake. High sodium consumption contributes to the high blood pressure, the main source of sodium in the diets and salt. The American Heart Association recommends that people without hypertension consuming less than 2300 milligrams of sodium per day. This roughly equal to 1 typation. People with hypertension should consume less than 1500 mg of sodium per day to manage their condition. Lowering salt intake can benefit people without hypertension. Moderating alcohol consumption, moderate to excessive alcohol consumption can increase the blood pressure. So this is all about the antihypertension. So thank you.